agreed, preparation is continuous. That's why. Honorable Ministers, dear colleagues and friends, all of this work to promote, provide, and protect health is supported by our efforts at all three levels of the organization on the fourth and fifth piece of GPW14 to power and perform for health through science, digital technologies, data, and our ongoing transformation. Last year, we conducted a review of our transformation to see what has worked and what has not. Based on the review, we have reprioritized transformation and aligned it with priorities of the GPW14. One of the successes of transformation has been our increased focus on science, data, and digital health, and this is the future of the organization. WHO's normative standard setting work is its bread and butter, and we have streamlined processes to give member states the highest quality evidence-based advice as fast as possible. Last year, there were 65 million downloads of WHO publications, guidance, and other materials. We launched important new guidelines on avian influenza, artificial intelligence, clinical trials, tobacco cessation, Mpox, and so much more. Starting this year, we're aligning our guidance and normative work with pre-qualifications, meaning we will pre-qualify a product and issue guidance on how to use it at the same time. The first product under the new process will be lenacapavir, an exciting new medicine for the treatment and prevention of HIV. Although a true HIV vaccine remains elusive, lenacapavir is the next best thing, an injectable antiretroviral taken every 6 months that has been shown to prevent almost all HIV infections in those at risk. We expect to conclude both the guideline and pre-qualification processes this year, which will support the subsequent rollout of this product. Another success of transformation has been our increased focus on digital health. Over the past 5 years, WHO has supported almost 75% of member states to develop strategies to harness digital technologies, including artificial intelligence, to strengthen their system. WHO hosts the Global Digital Health Certification Network, which last year enabled the Kingdom of Saudi Arabia, Oman, Indonesia, and Malaysia to issue 250,000 international patient summaries for 2024 Hajj pilgrims, supporting emergency care for 78% of scanned records. Many more countries are joining this year. The network now covers 82 countries, benefiting nearly 2 billion people. I thank the EU for its continued support for this work. Another key element of our transformation has been our focus on data. Every country in the world now accesses the World Health Data Hub, which is a secure and standardized pathway to increase transparency, accountability, and progress. Honorable Ministers, dear colleagues and friends, I hope you agree that we have many achievements to celebrate. But we also know that many countries face significant challenges. Many ministers have told me that sudden and steep cuts to bilateral aid are causing severe disruption in their countries and imperiling the health of millions of people. In at least 70 countries, patients are missing out on treatments. Health facilities have closed. Health workers have lost their jobs, and people face increased out-of-pocket health spending. Although this is a challenge, Many countries also see this as an opportunity to leave behind an era of aid dependency and accelerate the transition to sustainable self-reliance based on domestic resources. We're doing our best to support countries to make that transition. And yet, at precisely the time the member states need a strong WHO, it's being challenged. Although our current situation is difficult, it should not be a surprise to any of us. It's a situation many years in the making, and one that we saw coming. When we began the WHO transformation 8 years ago, as soon as I started my Director General tenure, one of the main problems we set out to address was WHO's over-reliance on earmarked voluntary funding from a handful of traditional donors. We have implemented several measures to alleviate that problem with your support, as you know, the past 5 years. We published the first investment case, established the WHO Foundation, conducted the first investment round, and 3 years ago, the Health Assembly took an historic decision to increase assessed contributions progressively to 50% of the base budget. This is the highest increase in the history of this organization. And thank you for your confidence and for that historic decision in 2022. This week, I ask you to approve the next increase to make another step toward securing the long-term financial sustainability and independence of your WHO. Already, the first increase has made a huge difference. If it had not happened, our current financial situation would be much worse, $300 million worse. Even so, we are facing a salary gap for the next biennium of more than $500 million. The Secretariat has taken a range of measures to curtail costs in travel, procurement, recruitment, early retirement, and more. These measures have helped to narrow the gap, but still there is no alternative but to reduce the size of our workforce. We're doing this reduction carefully to protect the quality of our work and ensure that we are positioned to emerge from this crisis stronger, more empowered, and more independent. As you know, we have been engaging in a major structural realignment, guided by an in-depth analysis of priorities, deliberate and conscious. The prioritization exercise has informed the development of a new streamlined structure for headquarters, which reduces the executive management team from 14 to 7 and the number of departments from 76 to 34. Some member states call the new structure lean and mean. I think it's more focused and it could be more impactful as well. Last week, I announced our new executive management team, and in the coming weeks, we will decide which directors will lead which departments. This was an extremely difficult decision for me. You can imagine that, and many of you have said that when we met, as it is for every manager on our organization who is having to decide who stays and who goes. I wish to place on record my deep gratitude to the outgoing members of our executive management team. Dr. Mike Ryan, Dr. Samira Asma, Dr. Bruce Aylward, Dr. Katarina Beme, Dr. Lee Ailian, and Dr. Jerome Solomon. Each of them has served the organization and the people of the world with distinction and dedication. And again, of course, without I ask you, you did it, but again, I ask you to join me in thanking them for their contribution and for the job well done. Thank you so much. Excellencies, let's be clear. A reduced workforce means a reduced scope of work. The organization simply cannot do everything member states have asked it to do with the resources available. This week, you will consider a reduced program budget of $4.2 billion for the 2026-2027 biennium. This represents a 21% reduction on the original proposed budget of $5.3 billion. Assuming you approve the increase in assessed contributions, and thanks to the investment round, we're confident that we have already secured more than $2.6 billion, or 60% of the funding for the next biennium. That leaves an anticipated budget gap of more than $1.7 billion. We know that in the current landscape, mobilizing that sum, that amount, will be a challenge. We're not naive to that challenge. But for an organization working on the ground in 150 countries, with a vast mission and mandate that member states have given us, $4.2 billion for 2 years, or $2.1 billion a year, is not ambitious. It's extremely modest, and I hope you will agree with me. And I will tell you why. $2.1 billion is the equivalent of global military expenditure every 8 hours. I don't know how many of us know this. $2.1 billion is the price of one stealth bomber to kill people. And $2.1 billion is 1/4 of what the tobacco industry spends on advertising and promotion every single year. And again, a product that kills people. It seems somebody switched the price tags on what is truly valuable in our world. I will share with you a story. At the Munich Security Conference in February, I'm a regular attendee of the Munich Security Conference since I became foreign minister in 2012. I haven't missed except during COVID. At that conference, a foreign minister spoke to me about the large increase in defense spending announced by some countries. Not some countries, actually many countries. Many countries are doubling or tripling their defense spending, and everybody knows this. And this is billions, hundreds of billions, and trillions. And he said, we have to prepare. When I asked him, he said, we have to prepare for the worst. I said, I understand, but what about preparing for an attack from an invisible enemy? Because you're only considering the visible ones, the tanks that may roll into your border, or the drones that may come overhead. How about the invisible enemy? The COVID-19 pandemic killed an estimated 20 million people and wiped more than $10 trillion from the global economy. I don't think you remember any war in recent memory that killed 20 million people. Countries spend vast sums protecting themselves against attacks from other countries, but relatively little on protecting themselves from an invisible enemy that can cause far more havoc and damage. If we think $2.1 billion is is in a year is ambitious, or 4.2 billion for a biennium, then either we must lower our ambitions for what WHO is and does, or we must raise the money. I hope you will go for the latter. And I know which I will choose, and I hope you will choose the same. On that note, I remind you of tomorrow's investment round event, and we look forward to seeing new pledges from member states and philanthropic donors. Honorable ministers, dear colleagues and friends, in 1951, the newly born WHO was already being buffeted by the prevailing geopolitical winds of its time, just as it is today. In her opening address, the acting president of the World Health Assembly that year, 1951, Ms. Rajikumari Amrit Kaur, the first Minister of Health of India and the first woman to preside at this assembly, said this, I quote, "The dark clouds that overshadow our skies today can and must be dispelled by the fulfillment on our part of the pledge to serve one another. Our work is surely a precious heritage which we may not forsake, and a positive factor for overcoming the root causes of conflict." End of quote. Today and this week, I ask you to remember those words from 1951, from the Indian late minister. We are here to serve not our own interests, but the 8 billion people of our world. To leave a heritage for those who come after us, for our children, for our grandchildren, and continues. And to work together for a healthier, more peaceful, and more equitable world. It's possible. Our current crisis is an opportunity to do just that. And together, we will do it. I thank you. Thank you very much.
Thank you, Dr. Tedros. Also, as per your instruction, Mabuhay is a Filipino greeting, and its direct translation is live long, healthy, and happy. I would now like to invite Dr. Katarina Bome, Assistant Director General, to kindly moderate the presentation of certificates of recognition to some countries for the public health achievements. Dr. Bome.
Mr. President, DG, Excellencies, let us now recognize and celebrate several countries, individuals, and organizations for outstanding public health achievements. First, I would like to invite Austria, Norway, Oman, and Singapore to come forward to receive their certificates of validation for trans fat elimination. We are honored to present these certificates today to the 4 countries that have put in place robust frameworks to eliminate industrially produced trans fat from the national food supply. Please join me in congratulating them.
Austria.
Austria. Norway.
Norway.
Oman. And Singapore.
Singapore.
Come a bit closer. Next, we are very pleased to recognize the remarkable achievements of the 2 countries that WHO has certified as malaria-free in the last 12 months, Egypt and Georgia. Egypt was certified in October last year, marking the culmination of a nearly 100-year effort, while Georgia also joined the ranks of malaria-free countries in January this year, following decades of targeted and sustained action.
100 years.
Georgia. Next, we're pleased to congratulate Botswana for becoming the first country to achieve gold tier status on the path to elimination of mother-to-child transmission of HIV as a public health problem. This is a very impressive achievement for a country with a high burden of HIV. Good. And last not least, we congratulate 11 countries that have eliminated 1 neglected tropical disease in the course of the past year. I would like to invite the following countries to receive their certificates of validation of elimination. First, Brazil for lymphatic filariasis. Timor-Leste, also for lymphatic filariasis. Chad for sleeping sickness. So back to Timor-Leste for lymphatic filariasis. Guinea for sleeping sickness. We now have India, Mauritania, Pakistan, Papua New Guinea, and Vietnam for trachoma. India first. Pakistan.
Thank you so much. Thank you.
Mauritania, I have Papua New Guinea. Yeah. And Vietnam. Now we have Niger for onchocerciasis elimination.
Okay.
And Jordan for leprosy. Okay, good. So now finally, we are pleased to honor this year's recipients of the World No Tobacco Day Awards. Each year, these awards recognize exceptional individuals and organizations who have made outstanding contributions to tobacco control. It gives me a pleasure to invite, therefore, the following awardees. Dr. Lina Nanushian, First Deputy Minister of Health of Armenia. Dr. Franz Pietsch, the former head of directorate at the Federal Ministry of Social Affairs, Health Care and Consumer Protection of Austria. The National Board of Revenue of Bangladesh. The Ministry of Health and Ministry of Finance of Brazil. Te Marae Ora, the Ministry of Health of the Cook Islands. Cook Islands. Coming? Good. An award to Malaysia, shared between Dr. Haji Zulkifli bin Ahmad, the Minister of Health of Malaysia, Dr. Norayana Binti Hassan, Deputy Director of the Disease Control Division, and Dr. Muniz Yami, President of the Malaysian Council for Tobacco Control. The Ministry of Health and Population of Nepal. Nepal. And the Directors General Special Recognition Award of Contribution to Global Tobacco Control is awarded to the Ministry of Health and Wellness of the Republic of Mauritius. So please join me in congratulating one last time all the awardees. Back to you, President.
Thank you, Dr. Bemi. Let us now suspend item 3. We will reconvene at 14:30. This meeting is adjourned.